My research focuses on emerging infectious diseases, particularly from the angle on how they affect national security and policy discussions. So several things we work on are any recent outbreak, for example, the Zika virus outbreak, and how to better prepare the country for outbreaks like this in the future. We look at antibiotic resistance, looking for high-level policy solutions that may change the face of this outbreak. So for example, we looked at non-traditional approaches. For example, instead of using just ordinary antibiotics, keep pumping up more antibiotics, we get more and more resistance, thinking about changing the whole game and going to more specific targeted therapies, looking at what's the case for things like bacteriophages, monoclonal antibodies, and how would you actually facilitate the use of those in a clinical setting. So a lot of that type of research where we're taking what's going on in the scientific world and bridging it into the clinical and policy worlds is where we kind of focus. What we did in this project, and what I did, is really take the ideas that have been percolating in the infectious disease community for a while about the fact that we're in this situation with bad bugs and no drugs, for example, and that every time we have a new antibiotic, it's invariably met with resistance. And before we had antibiotics, we did use very specific targeted therapies like serum therapy for pneumonias, and trying to meld that historical data with what's going on now in biotech with this revolution in monoclonal antibodies and targeted therapies, and really trying to illustrate what the advantages of this approach might be when they are available. And we've already seen, for example, in the last couple of weeks, Merck got a monoclonal antibody approved for C. diff infection, which is a really big breakthrough. And that's kind of what we do, is really trying to take a 10,000-foot level of the problem and move away from some of the minutia, and at the same time recognize that there is a lot of data and a lot of important advances that are going on that may not be well appreciated, or their full implications haven't been seen. And that's how we've kind of worked on that issue. And we do various other things. For example, with the Zika virus outbreak, we've been heavily involved in trying to understand how genetically modified mosquitoes might be used. So we conducted a survey of residents of Key West, trying to see what their opposition may or may not be, and what the what the factors were that influenced their decision. We did this pre-Zika, and we published that paper in PLOS Currents Outbreak, and we really got to understand what was driving people's opposition or support of genetically modified mosquitoes. And that's really important for the policy discussion that goes on, understanding where people's triggers are and how you might modify them. So with Zika, we've done a couple things. So we've worked on genetically modified mosquitoes, trying to understand what the decision points are going to be, and understanding what the public's reticence may or may not be. So that's one thing, and we brief that often to leaders in government and leaders in policy institutions. We've also, for example, I myself, in my role on the Infectious Disease Society of America's Public Health Committee, have helped with some of the guidance that's come out to clinicians, actually looking at the guidance and making sure that it makes sense, and making sure that it answers the common questions that people have about for example, testing and sexual transmission, for example. And we do a lot of speaking to the media and general op-ed pieces to the general public about these diseases, to try and distill what's going on in science and medicine to the level of the general public. And I think that's really important, because the more informed a person is, usually the less scared they are, the less panicked they are, the better decisions they will make regarding these types of outbreaks. And especially with Zika, where you have to get people to be aware and clean up standing water, for example, having them understand the facts about this are really important. Well, starting with the facts is the first thing that people have to do. If you actually know a lot about something, when something is unknown and scary and there's lots of unanswered questions and people are not able to really conceptualize what the risk is, that's much more scary, rather than saying this is a virus that's been around since the 1940s, has been having human infection since the 1960s, and we know all this about it. And then there are important questions we don't know, and clearly in this outbreak the virus is behaving in a way that we weren't anticipating. But the fact that this didn't come out of nowhere, that this wasn't some unknown Andromeda strain like in the Michael Crichton novel, really should make people less worried that science can meet these challenges. And when you look at Zika, I think it's one of the great examples of how quickly science and all of its branches, from clinical science to basic science to public health science, has really been working at breakneck speed to try and understand this outbreak and stop it. We already have 2 vaccines in phase 1 clinical trials, which is really unheard of with an emerging infectious disease outbreak like this. So a lot of the lessons probably that stem from the bad experience we had with Ebola have now been learned and are implemented, and we're seeing them come to fruition with the Zika outbreak. Well, I come here really just for the camaraderie and to be up to date and to see the leaders in this field speak about ideas that I think are really interesting and have kind of motivated my whole career. So when I'm here, I'm kind of just trying to soak everything in and really experience being in a convention center full of like-minded people who share my passion for infectious disease.